My name is Jacob. I'm a member of the Cause Production crew. I'll be heading off to college also next week at the University of Delaware. Go Blue Hens! But today we have a very excellent interview prepared for you today. I have the honor of interviewing Joanna Champney. She is the division director of the Delaware Division of Substance Abuse and Mental Health. I believe it's also known as DSAM. Is that correct?
That's right.
A few days ago on the Talk About It podcast, which I just finished up serving as host and producer of, I actually interviewed Joanna. We had an amazing conversation about addiction and about opioids and kind of like a microcosm of what this monthly focus is about. But Joanna, it's great to be here, and I want to kick off this interview by zooming in specifically on Delaware. What statistics and stories do you know about addiction and opioid use in Delaware?
Well, Jacob, thanks for having me, first of all. I'm really happy to be back. We had a great time on the podcast, and I really couldn't wait to come back and join you guys this evening. And I want to thank everybody for sharing the incredible personal stories of how this issue has impacted you. So we've already heard a little bit about how this issue is real for so many Delawareans, and I can certainly provide some numbers to put it in perspective. So last year, 2023, we lost 527 Delawareans, to either drug poisoning or accidental overdose. And I say drug poisoning because of something I'm going to address a little later on, which is that you often don't know what is in the drug supply, and so that's why we say drug poisoning, because the individual was not intending to overdose. The amount they took normally would not have resulted in an overdose, but it's because people don't always know what's in the substances they're taking that happens. So the year before, we lost 537 people. So a difference of 10 people. I mean, we're heading in the right direction, right? 10 fewer people. Many other states, especially those states on the west coast of the U.S., their numbers are continuing to increase, and so we are really glad in the Northeast that we're starting to see a downward trend, but we will not be satisfied until that number is at zero, right? Until we reach everybody who has an addiction issue, and we make services available for those people. So heading in the right direction, Jacob, but certainly not where we want the number to be. And one of the issues that my division really struggles with is ensuring that people can get access to treatment. And I know you want to talk about that in a little bit, but I do just want to talk about the numbers of people who may need treatment who don't have insurance. I'm sure you all, have had to navigate this in your own lives. Often your healthcare decisions are driven by what kind of insurance you have, which provider will accept your insurance. And so for people who don't have insurance in the state of Delaware, that's, considering people who don't qualify for Medicaid or they don't have employment that offers insurance. There's about 13 to 14,000 people in the state who are uninsured who may have an addiction issue. 13 to 14,000 people in the state who have potentially an addiction issue who don't have insurance. That is a lot of people who need to access care. Now, not all of those individuals are currently being referred to treatment and accessing treatment, but when we look at the numbers of the prevalence of addiction and opiate use in particular, the number is really high. And so our division works really hard to make sure that we have free state-funded treatment in all three counties at all levels of care. So we can get into that a little bit later, but by the numbers, about 13 to 14,000.
That is unfortunate. And when it comes to opioids specifically, I know that sadly tens of thousands of Americans per year have lost their lives to opioids. But when it comes to opioid addiction and substance use disorder versus addiction to other substances, are there any differences in terms of the social or medically speaking? Are there any differences between opioids and addiction to other substances?
Well, a couple things that I want to highlight about opiates in particular. One is something that we already heard from your audience earlier, which is the pathway into addiction often is begun through an injury, and so an opioid may be legitimately prescribed, and then that individual gets hooked on that substance and then may start to obtain that substance through illegal means, like illicit substances. And the danger with that is that it can lead to addiction to heroin and other similar substances. So the pathway often begins as an injury. The person is prescribed an opioid, and then it gets out of control. So that's something that I think is somewhat different than the other recreational substances that we often hear about, that pathway in. And that is why, because of the injuries, which we often see in the construction industry, people who work construction, I think I heard a couple people mention that, we have developed some toolkits for construction industry employers to help educate their workforce about the dangers of becoming dependent on opioids and where that can lead. So we have our toolbox, pun intended, our toolbox toolkit that's available on the Help Us Here website. So please spread the word. If you know people who work in construction, it's a great way for foremen and other people who work on those jobs to spread awareness with their employees about how to navigate that, and if it becomes a problem, where they can get help. Another industry where we see a lot of individuals who have overdosed having been employed is the restaurant industry. So we have our Restaurant Accolade program, which you can also find information on the Help Us Here website. We are getting ready to launch a video that talks about that program. And really what we're trying to do with that, Jacob, is equip restaurants to help their own employees because addiction is fairly prevalent in the restaurant industry. We also have had a number of situations where people have come into restaurants and unfortunately overdosed in the restrooms or sitting in a booth. That can be a really scary situation for someone who's working there. So we want those restaurant employees to understand how to respond to their overdose. And so the Restaurant Accolade program trains the restaurant workers on how to utilize Narcan. If you haven't heard of Narcan, it's an overdose reversal medication. Something that you basically kind of squirt up the nose, little puffs, and really easy to administer. If you are interested in getting trained on that, we have trainings regularly all throughout the state where the training is free. They're offered all different days of the week, hours of the day. You can sign up or just show up, and we give out the free kits and also show you how to use them. If you would rather not go to a training, maybe you want to keep it anonymous, go to the Help Us Here website. You can actually order it by mail, no charge, and we will mail it right to your door. It is crucial that we get Narcan into more hands. So last year alone, we distributed more than 32,000 units of Narcan, which this year we're set to far exceed. And so we're really targeting zip codes in the state where we see higher rates of overdose because we really want to saturate those communities and make sure that they have the tools to save a life. And then the last thing I want to mention is the risk to youth when it comes to opioids, right? So that, I believe, is also unique to opioids. The likelihood of teens taking pills that they believe are prescription pills that their buddy or, they stole out of a parents, friends' medicine cabinet or whatever, that does happen. And so the real danger with that is people think they know what's in the pill, but they often don't. And so you may have heard about the One Pill Can Kill campaign, and that is absolutely true because of substances like fentanyl, xylazine, bromazepam. There are some really scary substances in the street drug supply right now. And so we really want teens to be empowered to make smart choices. You often cannot trust where the substance came from. It is never a good idea to take a substance that you were not prescribed by a physician that you obtained from a pharmacy, even if you think you can trust the person who's giving you that substance. And so the One Pill Can Kill campaign helps teens to really understand the dangers of fentanyl. It is such a powerful substance, and really one pill truly can kill. And so we want to get that information out for school administrators, parents, caregivers. If you have a child or a teen in your life that you care about, I really encourage you to visit the Help Us Here website and check out the toolkit we have for how to talk to children and teens in your life about drug use. It has a lot of really great one-pagers that you can download and read. I have two young adult kids, one 18-year-old who's about to start UD also, and I've used it with my own kids. We've talked about it, and it's great. I mean, I work in the field, right? And even for me, it can be hard to have those conversations. So I really do recommend that for anybody who's interested.
Joanna, you've given us so much insight into addiction, into opioids. But for my final question for this interview, I want to focus on treatment. I want to confront this head on. Let's just say that someone who's experiencing an addiction or substance use disorder was standing in front of you right now, and you realize that they need help and they desperately need treatment and want to commit to living soberly for the rest of their lives. What advice would you give them? What direction would you point them in when it comes to treatment and resources and where to get help?
So that's a great question, because when someone's ready, you want to seize that opportunity. People can change their mind. Life can change people's minds. And so when people are ready, we want to make sure that they understand where to go. So the first thing I would say is, if you are helping somebody navigate this issue, go to Help Us Here. That is a great website that is going to have tons of information for you about where you can go. For most people who aren't clinicians, they may be a little confused about where to start. So what I would recommend is go to one of the bridge clinics throughout the state. We have one in each county. The one in Newcastle County is open later. The ones in Kent and Sussex are open during business hours. And that's a great place where you can walk in and talk to a clinician. They have psychiatrists. They also have nurses and peers who are in recovery themselves who can share their story. And we find that's really helpful in getting people to think about, like, is treatment for me? What's it going to be like? Here are the barriers that I have to going. Our peer specialists are amazing and can really help people think through whether that's a step they want to take. So the reason it's important to go to a bridge clinic or another type of treatment facility is that you need a clinical assessment. You need a professional to listen to you and help you think through your symptoms. They're going to offer a diagnosis, which crosswalks to a level of care. So what's a level of care? Level of care refers to what we call the ASAM inventory, right? So there's different levels of care. Detox or withdrawal management is the highest level of care. Then we've got residential treatment, we've got intensive outpatient treatment, and then we have sober living, or sometimes called recovery residences. So a whole continuum, right? And so people might start at the highest level and then flow down, or they may not need to do withdrawal management. They maybe, could go to outpatient or something. So really depends, and that's highly dependent on the person, the substances that they're utilizing, what's happening with their mental health, any medical issues that they're navigating. So that's where it's really important to talk to someone who specializes in addiction medicine who can help you navigate that. And then the other issue, which I alluded to earlier, is insurance. So if you do not have insurance, the state of Delaware does not want that to be a barrier to care. And that's why we've invested over $40 million annually into free state-funded treatment. So if you don't know where to go, we have a great guide called The Guide to Accessing Publicly Funded Addiction Treatment that's also available on Help Us Here. You can go there. Once you find out what level of care is needed, you can look by county and cross-list there, and there's a phone number that you can call. So the bridge clinics statewide are more than happy to help people navigate that, because it's hard to know where to start. And so we want people to know that the state is here to support their journey, and if they have questions, they can certainly reach out to DSAM, visit bridge clinics, give us a call, and we'll be happy to help. So yes, we really encourage anybody. The most important thing when you are helping a loved one navigate addiction is to keep that open line of communication. It is critically important for people in recovery to have loving, supportive relationships. And so the best thing that you can do if someone in your life is struggling is to talk about it. And no pun intended, but talk about it. Have those conversations, show that you care, offer some practical supports, and maybe suggest to go with them to a bridge clinic or something like that, because showing that you care, regardless of where someone is in their addiction journey, we know that recovery happens in relationship with other people. That's really crucial.
Absolutely. Joanna, thank you so much for diving deep into addiction and treatment. Let's go give a huge round of applause to Joanna Champney, the director of DSAM. Thank you so much, Joanna.